It's 2:13 a.m. The house is quiet, but you're up again, moving toward the bathroom on autopilot. You stand there in the dim light, feeling that urgent pressure, but what you get is a weak, hesitant trickle that never quite feels like enough. That frustrating gap between the urge and the result, that hollow feeling of incomplete emptying, follows you back to bed, where you just wait for the next trip to start the cycle again. If your nights are broken into fragments and your days are planned around bathroom locations, this message is for you. That struggle with a weakening stream and constant urgency doesn't have to be your permanent normal. Many men believe an enlarged prostate means their comfort is just gone for good. But what if a big part of that daily battle is not about the size of your prostate at all? What if it's fueled by a simple habit you perform in the bathroom, a habit you can change starting tonight? I'm Dr. Katherine Rotker. Welcome to Harmonic Health Seniors, where we focus on real, actionable steps for men's health and vitality. Today, I'm giving you one single habit, a 40-second retraining of your bathroom routine that can lead to a stronger urine flow, a more complete sense of emptying, and far fewer of those frustrating urges. You can often feel a difference in the first few days, and I'll show you exactly how it works. If you want clear tools you can actually use, please like this video and tap the bell. All right, let's get into it. A lot of men believe that an enlarged prostate, what we call BPH, is a sentence to permanent, ever-worsening decline. That belief that it's all downhill from here is pervasive, paralyzing, and frankly, wrong. While it's true the prostate itself may slowly enlarge, the symptoms you live with every day are not locked on a fixed, irreversible track. They're dynamic, and critically, they're influenced by factors you can control. Your day-to-day discomfort isn't just a readout of prostate size on an ultrasound screen. What you feel is a complex signal made up of several parts: the swelling and congestion in the area, the irritation inside your bladder, the tension in your pelvic muscles, your body's stress hormones, and when you drink fluids. Even your breathing pattern in the bathroom plays a role. This isn't just anatomy, it's physiology and habit. And habits can be changed. Let me be very clear about what fast means so I don't lose your trust. If you're imagining your prostate gland shrinking to a youthful size by tomorrow morning, that's not how it works. Real tissue change is a gradual process, but inflammation can subside in days. Muscle tension can release in minutes. Bladder irritation can calm in a week, and your flow mechanics can improve the very first time you do this habit correctly. So when I say boost urine flow fast, I'm talking about rapid, symptomatic, and functional improvement. We're aiming for measurable relief you can feel now, while longer-term strategies work in the background. It's sleeping through the night or cutting those trips from 4 down to 1. It's standing up from the toilet with a confident sense of, I'm done, not nagging doubt. It's watching a movie or taking a car ride without the background anxiety of, what if I need to go? It's your system working with you again, not feeling like a daily betrayal. This is the immediate goal. Now here's the ironic twist that most people have never been told. The stress and anxiety caused by your symptoms actively worsen your symptoms. Think about the moment when you feel frustrated by a weak stream or anxious about an upcoming trip with no bathroom in sight. In that moment, your nervous system reacts. You might unconsciously hold your breath, your shoulders tense up, your jaw clenches, and most importantly, the muscles of your pelvic floor and abdomen tighten into a protective brace. Without realizing it, you're literally, physically clamping down on the very passage you're trying to open. It's like trying to drive with the parking brake on. This nervous system tension is one of the most overlooked drivers of urinary misery in men over 50. This explains a common mystery, why one man with a moderately enlarged prostate can be utterly miserable while another with a larger gland functions fairly well. The difference often isn't the prostate itself. The key lies in the pelvic floor, the group of muscles that form a supportive hammock for your pelvic organs. A prostate that's a moderate blockage, combined with a pelvic floor clenched like a fist, creates a severe functional blockage. Conversely, a large prostate with a relaxed, coordinated pelvic floor may be a mild nuisance. Your symptoms are not just anatomy, they are anatomy multiplied by mechanics and nervous system signals. The solution targets to this exact equation. I call it the nervous system reset and double void technique. It's a 40-second, two-phase routine you do at the toilet. Phase 1 is the nervous system reset, a specific breathing pattern to calm your stress response and release pelvic floor tension before and while you urinate. Phase 2 is the double void, a strategic pause followed by a second release to ensure your bladder empties completely and to retrain those urgent signals. Together, they work because they directly counter tension, rushing, and leftover urine. Before I walk you through it, there's one thing I want very clear in your mind. This isn't a forcing technique, it's a releasing technique. If you try to muscle through it, you miss the benefit. Here's how phase 1 works. Next time you feel the urge to pee, don't rush. Pause for a moment before you start. Stand at the toilet and let your shoulders drop. Now inhale through your nose for about 4 seconds. Nothing dramatic, just enough to let your lower ribs expand and your belly soften outward. No sucking in. Then exhale slowly through your mouth for 6 to 8 seconds. Keep it gentle, easy, controlled. As you breathe out, unclench your jaw. Let your shoulders fall. Let your belly stay soft. As you do this, focus on the base of your pelvis. Think of your sit bones, the bones you feel when you sit on a hard chair, gently melting downward. Create a mental sense of space and opening in that area. You are not pushing or bearing down. You are simply allowing. That long, slow exhale acts as a direct signal of safety to your nervous system. It tells your body it is okay to relax and let go, which is the exact state you need for a better urine flow. This whole reset takes about 10 seconds and sets the stage for everything that follows. Now begin urinating. Keep that sense of ease you just created. Do not hold your breath. Do not push or strain with your stomach muscles. Let the stream start when it starts, even if it takes an extra second. If you're standing, keep your knees slightly bent. Consider sitting down to urinate, especially at home. This isn't about masculinity, it's purely better mechanics. Sitting allows those muscles to fully relax, removes balance tension, and studies show it can improve emptying efficiency. Whether you sit or stand, the important thing is to let your bladder do its job while you keep the outlet relaxed. When your stream naturally ends, this is the critical moment most men miss. Do not move. Do not walk away. This is phase 2, the double void. First, pause right there for 10 seconds. Count it slowly in your head. During that pause, take one more reset breath. Inhale gently for 4 seconds, then exhale fully for 6 to 8 seconds, softening your belly and pelvic floor again. Now, simply wait and observe. Very often, you will feel a second, smaller release of urine. It might be a few more dribbles or another short stream. This is the double void. That's it. The whole sequence adds about 40 seconds to your bathroom visit, but it eliminates the residual urine that irritates your bladder and causes those maddening again urges minutes later. It's the single best habit to reduce nighttime trips if done consistently before bed. By now, you might be thinking, okay, this is a great bathroom hack, but how does it actually shrink my prostate? That's a fair question. Let's connect the dots. Your prostate sits around your prostate urethra, the tube that carries urine out. When the prostate is enlarged or inflamed, that area is a bit like a tender, swollen collar gripping the hose. If you constantly increase pressure in that area, say straining every time you pee, you're effectively squeezing and irritating that already sensitive prostate collar even more. It's like constantly pressing on a tender spot. That daily mechanical stress can worsen local inflammation and congestion. This habit switches you from a pressure-dominant to a release-dominant emptying style. You're removing that daily source of irritation. When you stop aggravating the area, the tissues naturally begin to calm down. While the prostate gland may not change size overnight, the functional obstruction and the feeling of swelling decreases significantly. You've effectively shrunk the problem's impact. Beyond mechanics, this habit performs nervous system alchemy. That long, slow exhale is a direct signal to your parasympathetic nervous system. This is your body's rest and digest state. By consistently pairing urination with this calm, controlled ritual, you're retraining the entire connection between your brain and your bladder. You're teaching an overactive, sensitive bladder that urgency isn't required. For many, this reduction in false alarm urgency is the most liberating change of all. Take a patient I will call Mark, 68. His life was ruled by just-in-case trips. After 2 weeks of practicing the double void, his frustrating 5-minute later urges dropped by 80%. He told me, "I finally got my confidence back to leave the house without mentally scouting the toilets." Or James, 71, for whom the 3 a.m. wake-up was a given. By combining the pre-bed double void with slightly earlier hydration, he now sleeps 4 to 5 hour stretches consistently. "It's not perfection," he said, "but it's a life changer." Before you lock this habit in, let's go over a few common missteps I see that quietly cancel the benefits. The first is turning the exhale into a push. If your face tightens or you feel strain, you're pushing. Aim for a soft sigh of relief, not a forceful shove. The second mistake is skipping the 10-second pause. That pause is where the magic happens. Don't cheat. Third, avoid the perfection trap, getting discouraged if a second void doesn't happen every time. The habit is the ritual, the outcome will vary. Fourth, ignoring the bowel. Constipation physically crowds the bladder. Manage this for best result. 5, sabotaging with fluids, doing everything right but drinking a liter of water before bed. Finishing your main fluids earlier in the evening lets the habit do its job. Pair this habit with these simple, synergistic actions. First, take a 10-minute walk after your largest meal, often dinner. This boosts circulation to your pelvic area, reduces congestion, and supports stable blood sugar, which can lower inflammation. Second, observe a caffeine curfew. Shift your coffee or tea to before noon. Caffeine is a direct bladder irritant and can increase urine production, sparking more urgency later. Third, practice a daily nervous system drill. Twice a day, try the 4-7-8 breath. Inhale quietly for a count of 4, hold your breath for 7, and exhale completely for 8. Just 2 minutes of this helps lower your overall stress and tension. Finally, consider warmth therapy. A warm shower aimed at your lower abdomen before bed can soothe muscles, increase blood flow, and promote relaxation in the entire pelvic region. This habit is for managing common symptoms of an enlarged prostate. It's not a substitute for medical care. If you experience any pain or burning during urination, see blood in your urine, run a fever, or especially if you have a sudden, complete inability to pass urine, seek immediate medical attention. This technique is a powerful complement to medications like alpha blockers or 5-ARIs, not a replacement. Now, don't approach this as a challenge or experiment. Approach it as a new essential bathroom hygiene. Just as you brush your teeth without debate, you now do your 40-second reset. It's not optional, it's just how you go. This simple shift in thinking from trying a tip to adopting a standard practice is what leads to lasting change and consistent prostate symptom relief. Many men feel betrayed by their bodies. This habit represents a shift from frustration to influence, not by fighting harder, but by understanding smarter. You're moving from being a passenger on a declining track to being the conductor, gently guiding your body back toward cooperation and comfort. So, to lock it in, first at the toilet, take a reset breath. Inhale for 4 seconds, then exhale slowly for 6 to 8 seconds while you release your pelvis. Second, urinate with calm. Don't strain. Third, pause for 10 seconds after the stream ends. Fourth, take one final reset breath, just like the first. Fifth, wait and allow the double void to happen. A stronger flow, a calmer bladder, and more sleep are your likely rewards. Tonight, I encourage you to try it. Then, I really want to hear from you about your experience. In the comments, type night if nighttime trips are your biggest battle, flow if a weak stream is your main frustration, urgent if sudden urgency rules your day, or empty if that incomplete feeling bothers you the most. This guides what I'll cover in a future video to help you even more. If this practical, respectful approach resonates with you, please consider subscribing to the channel. We're building a library of respectful, science-backed strategies for your vitality. We cover sleep, circulation, metabolic health, and confident aging. Hit the notification bell so you don't miss our next video, where I will dive deeper into the topic you choose in the comments. Thank you for your time, and I look forward to hearing about your progress.